Thank you very much for introducing me. You already said a bit about ENIL. So, as mentioned, my name is Florian Sanden. I should say at the beginning that I am also a late diagnosed autistic person. I found it started to crystallize in the course of the last years that it became clear that I'm on the spectrum. I'm one of the people who for whom this discovery really put a lot of life experiences into place. So I'm quite grateful for it. Yes, as mentioned, I work for an organization called the European Network on Independent Living. I posted the link on the chat. I did not prepare a presentation, unfortunately. Who or what is the European Network on Independent Living, ENIL? We are not a research organization as such, although we conduct research too, not on autism specifically, really on all kinds of disability, but autism is an important part of our work. Primarily, we are an advocacy organization. We are very clear. We are lobbyists. We try to influence politicians. We as ENIL, especially on the EU level, to take into account disability rights, and especially we work politically towards the implementation of what we call the independent living principle or philosophy, which really is for us the most thorough form of disability rights advocacy, meaning that disabled people get in all areas of life the same rights, the same access to things as non-disabled people, get to enjoy the same autonomy and self-determination. And thus for us, very much at the center of our activity is, because of this, the full implementation of the United Nations conventions on the rights of persons with disabilities. As policy coordinator, it is my job to, to coordinate our lobby work. So I'm quite in charge of this. For us, the most important obstacle towards to implement the independent living principle is the unchanged prevalence of institutional living arrangements for disabled people throughout Europe and the world, really. In institutions, we understand all living arrangements which take away, curtail disabled people's self-determination, autonomy in any way. So we advocate for the complete removal of long-term residential settings such as nursing homes, group homes, or also long-term psychiatric hospitals. For us, this is very much reflected in the UN CRPD Article 19, for example, which states that disabled people have equal rights, like all persons, to live in the community with choices equal to others, and have the opportunity to choose their place of residence and where and with whom they want to live. So, according to the UN CRPD, institutions are a human rights violation by themselves. However, we as ENIL also, there is the Committee on the Rights of Persons with Disabilities and the UN Special Rapporteur. We conduct regular monitoring of numerous other human rights violations connected to institutions. For example, Article 19, the right to liberty and security, or Article 15, that's especially depressing sometimes, the freedom of torture or cruel, inhuman, or degrading treatment. And from these reports and our monitoring, we know that autistic people are strongly affected by lots of these violations. For example, in our shadow report on the implementation of the UN CRPD published this February, there was investigative researchers of us revealed a shocking case in Finland where a child with autism was found to have been taped to a chair during the day and to the bed during the night for 5 years. The child had strong self-harming behavior. However, the institution did nothing to address the root cause. Self-harming behavior is usually a sign in children of emotional neglect, but they choose the easy way, so to speak. In France, according to my information, it's still the case that autistic children can be institutionalized against the parents' will. There's evidence that use of seclusion or restraints, the practice of packaging or electroconvulsive therapies is still applied in France or elsewhere. There are cases of psychological and sexual abuse, threats of involuntary hospitalization made by medical personnel. In this case, there are reports on this happening in France, but there's also evidence of this happening everywhere in other places. Just this week, recently, the Committee on the Rights, UN Committee on the Rights of Persons with Disabilities, published its concluding observations for Hungary. And for example, there's evidence of forced contraception of autistic women in Hungarian institutions. For us, these violations, they are so frequent that we say it's not an error in the system, it is the system because of the power imbalances inherent in institutional settings. These violations, they happen and they will continue to materialize until institutions are removed from the equation, so to speak. Unfortunately, in the decade since the European Union became party to the UN CRPD in 2011, the number of autistic people in institutional settings, on disabled people, this would actually be an interesting topic for research. There are no exact figures how many autistic people do live in institutional arrangements. Yes, it is estimated, but we also don't have figures for disabled people in total. So these are estimates, but well-researched estimates. And they say that 1.4 million people, disabled people, live in institutional arrangements throughout Europe, which is the same since a decade ago. The European Union and member states are still spending considerable amounts of money in building, investing, and running of institutions. We want the European Union and its member states to stop investing in institutional settings. But with this, when I talk to people and tell them about our goal, our political goal to end institutions, they always ask, well, what do you want to do with disabled people instead? Do you leave them out on the road? Do they get no support? No, of course not. There are well-established, well-researched and alternatives, which we refer to as community-based support services. For us, community-based support services imply that disabled people can live at a place of their choosing and have all the services and support they require to live as autonomous and self-determined as everybody else. And we lobby the EU and the member states to stop spending in institutions and invest in the expansion of community-based services, which already exist but require more funding. A key component of community-based services for us, which really refers to a whole bundle of things, is access to personal assistance. In contrast to home care, personal assistance implies that not only things related to health and hygiene are taken care of, but a personal assistant, a PA, really helps you with all areas of life where you need support. Yes, for example, in cleaning the house, in doing your groceries, but also organizing a party or going to a bar. There's really no reason why disabled people who need support should live like moms. You are entitled to do things other people do. As long as it is not illegal, and is really supposed to be upon yourself to judge what to do. For us, good PA, good personal assistance has to follow certain elements. It has to be 100% free of institutional frameworks, which is a big challenge because they can easily creep in through the back door. There must be no unreasonable limitations on what to do or where to go. You must be able to take your PA on a holiday. It must give you the spontaneity everybody else has. It has to be individually controlled and led. The disabled person's personal preferences must be respected and utilized. You have to be able, for example, to make the choice who works for you as a PA. There are some PA providers who give you no choice, who tell you which person has to do the PA. And for us, this is really not okay. For disabled people, for some reason, because this one-on-one relationship implies also a considerable amount of managing work. You have to be the boss in the relationship as the disabled person. This implies to manage your PA, telling them what to do, in which order. If for some reason you are not able to do this managing, it must be able to exercise your PA, manage your PA to support the decision making or through assistive decision making. It has to be, PA has to be based on personalized assessment. It is key that disabled people are really not put into boxes. Everybody has somewhat different support needs, and it really has to be tailored to your individual support needs. PA has to always be delivered as a whole package. There recently was a decision of the CRPD, the committee, in a case where Finnish authorities decided to divide up support package. This is not okay. Of course, the PA, this is sometimes a challenge, has to enjoy good standards of employment. You really don't want a person to be a PA who has to work unreasonable hours or is low paid, low wage, because it's a very responsible position. It needs to be sufficiently funded, no out-of-pocket payment, and it needs to be provided wherever you want to live. So really to give you the full autonomy. There are other elements in community-based support services, for example, access to housing, access to employment and income, which is often, also when it comes to autism, a challenge. Not to speak of attitudinal barriers, access to income replacement if you cannot work. For our lobby work, it is really key for us to emphasize time and again that the UN countries need to implement or establish plans for action for deinstitutionalization with clear objectives and timeframes, what they often don't have. We need an expansion of quality PA throughout Europe. In our own research, we found that throughout Europe, 97% of respondents of a survey we did say a PA is inadequate in their country. We need stronger employment protection legislation. There are a number of policy initiatives on the EU level which are coming up, which we're working on to influence. In 2023, the European Commission, for example, will publish guidelines on independent living and inclusion. And we will do everything we can that our vision for PA and community-based services is reflected there. These guidelines, it will be used to shape member states' policies. Guidelines on social services of excellence are coming up. This year, the Commission is working on a long-term care strategy. In this part of the CRPD review work, there are regular reviews of member states, implementation of the UN CRPD. The youth review cycle has started this year. We want to use this opportunity to put this topic higher on the EU's agenda. And also the committee has already called on the EU to review its spending policies. We have to work on this.